So you've rolled your ankle and you want to know if you need to go to the doctor or how Chinese medicine can help, and then also reduce some pain, improve your mobility, and eventually get you back to sport. So today we're going to talk about some of the checks you can do, and if they test positive, you really want to make sure you go to the doctor just to make sure that you're checking out everything's all right. Then we're going to walk you through some simple acupressure you can do for yourself to help bring down the pain, improve mobility, and help you start to feel better. And then we're going to go through some of the mobility stuff and exercises you can do that stagger your progress to get you back to doing what you want to do. So please stay tuned, hit the like and follow button. So you've rolled your ankle. The first thing you want to do is you want to get a good look at your whole leg. I've prepared this from about the knee down. The reason for that is if you've rolled your ankle, sometimes the fibula, which is the bone that goes through there, it can break, and it can even break all the way up here. So the first thing you want to do is make sure there's no obvious deformity, so there's no bones sticking out, there's no blood everywhere. Once you've done that, it's okay, there's a little bit of swelling. The next thing you want to do is you want to palpate down between there and there. So you get your hands and you can just squeeze the bones together. If this elicits any pain, or a lot of pain from here down, that's letting you know there's potentially a break in there, or on the other side, like Conor McGregor at the fights the other day. You definitely want to go to the doctor, get that checked out, get a scan, make sure you're on the right track. If it get down to here and you're pushing together and you're getting some pain through here, that can let you know that you've actually done some damage to the ligaments that hold those two bones together. Once again, you really want to make sure you go get a scan and check that out, because that can lead to long-term ankle instability. The other thing that you need to be able to do is that if you can't weight bear on it, that's another good sign there's potentially a break or some major mischief. You really want to make sure you check it out. Also, if there's lots of swelling and lots of bruising, make sure you go. Essentially, if in doubt, go to the doctor. The next thing you can do from there is you can see that little bone there. You want to palpate all the way around there, and if there's any tender spots, that can let you know that one of these ligaments is actually pulled off the bone, or you've got a breakthrough there. That, once again, is a good signal to you that you want to go to the doctor. Make sure you check it out. Following that, this bone through here, just after the little toe, palpating all the way or feeling all the way through there up to the end, and then coming around there. That also could be a signal of a break as well. So we want to make sure you take that seriously, get it checked out. The other side, there's a bone here, so you want to make sure you feel it all the way through there. Once again, checking the whole length around, and then coming up about 10 to 15 centimeters. If there's pain along there, please go to the doctor. I missed that you should actually do 10 to 15 centimeters up on there as well. And then the next bone, you want to have a feel of the navicular, which is just below there. You want to make sure you feel around its border as well. And if there's any pain on that bone, please go to the doctor. Essentially, if in doubt, go to the doctor. But let's say that you've done that, it's all pretty good. There's not too much swelling, there's not too much bruising, and you just want to see how you go. You want to maybe come get some acupuncture, or take it from go see a physio, whatever suits you best. I'm going to say acupuncture because that's what I do, and I think it's the best. So the first thing you want to do is what they call PRICE. That stands for protect. So you've just heard it, look after it. If you've got a brace, put it in a brace for a couple of days. Don't go running around on it. Rest. So don't keep opening it and trying to find the pain. So if you've done a mischief and a little bit of a tear in there, the last thing you want to do is actually start trying to move it around and stretch it too much, because you might reopen it and make it feel a bit worse. So that's where rest comes into it. You want to leave it alone for a little bit. After that is ice. So during the first kind of like 10 to 3 days, your body goes through like an inflammatory process. So ice in the first kind of day to 48 hours, 20 minutes on, 3 times a day, that can help slow down some of that swelling, reduce some of that pain and inflammation, and help kickstart it. Too much swelling can actually impede some of that. So a little bit of ice for the first day or two can really help reduce pain and reduce swelling, and hopefully promote healing faster. After that is compression. So coming back to that idea of maybe you want to protect like with a brace, compression does the same thing. It helps protect it, but it also helps some of that swelling return back into the body, and be recirculated around, and then elevation. So for the first couple of days. Putting your foot up every chance you get is going to help that swelling return into the body and then help it heal and improve. So that's what you want to do the first couple of days. After that, you want to start reloading, but at an appropriate level. So pain should always be your guide. If you have done yourself a tear, and there's a bunch of different grades that you can do it in. So grade 1 is essentially just 10% or less of the fibers. So it's a little bit sore, a little bit of bruising, a little bit of swelling, but you can still weight bear. It's not too bad. You still got full like movement and stuff. No real instability. You can maybe get away with self-managing yourself. Grade 2 is between 10% and 90% of the fibers. It's the big bracket because it's pretty hard to tell with just your eyes. So if there's a fair bit of swelling, there's some bruising, maybe a little bit of instability, but not too much. If there's instability, that's another reason why you definitely want to go to the doctor and check it out. And even if you have done all those tests and it comes back and it's not sore, it's not 100% perfect. Like you still might miss some weird fractures. So if it doesn't get better, or it seems like it's not improving, it's always a good idea to go to the doctor and check it out. So the first thing you want to do is when you're starting to reload, you need to have pain be your guide. So if in that first kind of days, the one thing they want you to start doing is what they call the ABCs, and that is essentially just to help get the body back moving and using the ankle. So you just literally imagine you're drawing an A, B, C, and you go all the way to Z if you can. In those first few days, you might find you only get to D or E before it really starts to fatigue. And then, so stop around about that point. But then over time, you should be looking to see if you can build that up. So fatigue is good, and don't overdo it, but pain, particularly sharp pain, is bad. So stop doing that, give it a little bit of a break. So let's say you've continued for a few days, you can do your ABCs, the swelling is coming down, you're starting to feel much better on it. Then you want to be starting to see if you can reintroduce weight bearing and then working on your body's what they call proprioception. So you're figuring out that your body knows exactly where your ankle is and working on building that strength so that you can start to improve. The next phase after you've been doing your ABCs is you want to move to what's called isometric kind of strengthening. So this starts to put load back through the tendon so that it can help those fibers knit together. But instead of knitting together all kind of meshed up, it actually knits together nice and strong like that. So the first phase is isometric, which means leave the foot where it is, but resist pressure. So you do it in 4 directions. Start easy. Once again, if you have sharp pain, stop. So down. So I'm pushing and I'm just resisting with my foot like that. So that's helping to strengthen all through here. Then this way, that's one particularly good. So coming up like that, I resist through there. That's going to be strengthening those ligaments through there. And these are the main 3 ligaments if you're going to do mischief to your ankle. So you can see how if you put pressure like that, you're kind of strengthening them. Then coming here and like that. So you can do that 3 times a day, 3 to 30 seconds each. Once again, letting pain be your guide, and fatigue is good, but pain is bad. So if you get to the point where you can do that a few times, 3 to 4 times a day, 15 to 30 seconds each, no pain, feeling quite strong, then you're ready to kind of progress to the next thing. And the next thing, once again, we're working on that proprioception, so knowing where your foot is in space, as well as starting to strengthen and reload this tendon so it starts to build and get stronger. It's really simple. Start holding onto something so you don't fall over and hurt yourself again. You can just stand on one leg. So notice how my leg is just a little bit above the ground, so it's not too much weight, and I'm also holding onto here. So if I want to make that harder, I lift my leg up, and you can already see like the muscles in my foot starting to work harder to keep my balance. And then when I feel comfortable, I can take my hands away, and you can see those little intricate muscles starting to work hard to hold that in space. So once you can do that without any pain, once again, fatigue's good, pain bad, up to 15 seconds to a minute at a time, 3 to 4 times a day, then you're ready to start to challenge that a little bit more. So let's say you've done a couple of days of doing that, you're feeling pretty good. The next phase is you want to see if you can increase the load, make it a little bit harder. So once again, you're on one leg, but then you're starting to step forward, step to the side, step back, and then depending on how you want to do it, you can go to that way, or you can come forward like that. Back's probably better. And doing that for a minute, 3 to 4 times a day, just to build that up. So once you can do that comfortably, without fatiguing, without any pain, then you can make it just a little bit harder again by standing on a cushion. And you want to build it up the same way that you did. So you're better off starting slow and building than going too hard and hurting it and setting it back. So just standing on it, holding onto something. Can I lift my leg up just a little bit? Yeah, that's pretty good. Can I go a little bit higher? Yep, pretty good. Okay. Oh yeah, that is harder. See how my leg has to work harder? And then going back to doing these. Once we've got into that area, and you can do that comfortably, we want to be starting to get back to have you ready to do some kind of sport or whatever it might be. So we want to challenge this a little bit more. So you want to start strengthening it. So the way that you start strengthening it is, once again, holding onto something. You can start with just heel raises with 2 feet, and then coming back onto the heels, just holding onto balance. No big drama with that. Once you can do 15 sets of that really easily, 3 times a day, fatigue good, pain bad, then guess what? You move to one leg. Oh yeah, that's pretty good. It's a little bit more challenging to lift the leg. So once again, hold on to something. Three sets of 15, starting to feel stronger. Great. The next thing that we want to be starting to do is see if we can strengthen the side. So that first one did this, and then we want to see if we build the strength through there. This has a name, I can't remember the dance move, but essentially you start with 2 feet, onto your toes, shift. Onto your heels, shift. So that's working all of those little intricate muscles in the foot and the calf, but also starting to work these muscles in the hip, get them firing better, so you can start to figure out where your foot is in space. So you want to be able to do 3 meters forward, 3 meters back, 3 times a day. Once again, fatigue's good, pain bad. So if you get any pain, slow down, do less, give it a little bit more time. And this, depending on how bad it is, can take, you can get to there in a couple of weeks. Sometimes that can take up to 4 or 6 if it's really bad. So just let pain be your guide and ease into it. So once that's good with 2 legs, then you want to move to 1. So it's just as, once again, a little bit harder. And I'm already a little bit tired from standing on 1 leg, and then all the way back and all the way back like that. If I do I actually have an injured knee at the moment, so that's why it's really hard, because this muscle's not firing properly. So if I do my other leg, you can see how much easier it is, like that. So that's where you want to be getting to before you move on. So I'm not quite up to that stage with this. Then once we've got that, you're doing pretty good. We want to be getting you ready, putting a little bit more load through there, so you can do lunges from side to side. So it's really easy. Lunging down. So that's opening up that injury through there. Just got a little bit of strain, a little bit of fatigue is fantastic. And then coming back through like that, closing that off, feeling good. So you want to be able to do 15, 3 times a day, without pain, just a little bit of fatigue. And once we've got that, we're ready to start getting you ready to go back into jogging and things. But the test for that is, can you do 15 seconds of double leg hops without any pain? If you can do that, yep, really good. That means it's starting to heal, you're not hurting it. Once you can do 3 sets of 15 seconds without any pain, fatigue's good, then you can move to the single leg. Really good. So once again, 3 sets of 15 seconds, 3 times a day. If you can do that without pain, you really are moving into that next phase. And the next phase is just testing it a little bit more. So then 1 leg, so just hopping on the spot, starting to make it a little bit more dramatic, but not too crazy. Like if I'm still healing, I'm a little bit sore, if I really jump hard, I might hurt it. So slow and steady. So just a little bit. Do I feel comfortable? Do I still have my balance? Once that's working well, then we can go back to these lunges. But instead of doing lunges, we're going to do a little bit of a hop. And then when we're feeling good, really, so pushing off and accelerating, decelerating, feeling great. Once we've got that, once again, 15 seconds, 3 times a day. Before you head back to sport, you really want to be able to hop around and then stop and then run. And if you can do all of that without any pain, feeling stable, feeling secure where your leg is, you're good to start reintroducing some of the exercises that injured it in the first place. So I want to show you some acupressure stuff you can do to help that and get that better faster. So one of the easiest things to do when you first hurt it to help rebuild that is essentially a general acupressure point we've got here that helps reduce pain and inflammation throughout. So if you have a look, I'm going to put my thumb and hand together like that, forms a nice little mound. Right in the middle of that, there's going to be a nice tender spot. That helps reduce pain throughout the body. So by putting pressure on there, when this starts to relax, you'll find that it starts to reduce some of the pain through there. The next main point that we want to use is one point that's about 4 fingers up from the wrist crease in between the 2 bones. You're going to find a nice tender spot. From our point of view, that helps relax all the muscles around there and will help you be able to do those kind of ABC movements, help find where this is in space better so you can get more out of those exercises and also start to improve a little bit faster. Things that you can do to help in terms of diet to help that improve are pretty straightforward as well. So if you've injured a ligament, your body needs the building blocks to improve that. So you need collagen, you need kind of fat, and you need protein. In China, one of the main meats that they'd recommend for that is actually pork, or like meats that have like bone and gristle and things like that. So you could use pork if you had that, like a nice pork belly or something along those lines, or pork spare ribs, my personal favorite, or just like a fatty kind of like gristly bit of meat would be amazing. On top of that, you want to improve the blood supply and reduce any of the inflammation through there. So some simple herbs that you can just use at home, things like cinnamon, ginger, and turmeric, they help with improving circulation, improving the blood supply, and reducing kind of inflammation. So making sure that you do that, progressing those exercises, and then doing these little acupressure points will help you get more out of that faster. If you come in and see an acupuncturist or a Chinese medicine practitioner, the first thing that they're going to do is, number one, make sure it's okay, that you haven't really done yourself a mischief. They might still suggest you go to the GP, get a scan just to be really safe, because information never really hurt anyone. Then they're going to be looking to reduce the swelling and then get that mobility back as fast as we can, as well as using the needles in combination with those exercises, so that everything starts to strengthen faster, starts to get better faster, and really improve that cycle. On top of that, they'll also look at how your sleep is, how your digestion is, and a few other bits and pieces. So if you've rolled your ankle but it doesn't seem to be getting better, one of the things they'll check is to make sure that you're sleeping well. Because if you're not sleeping, your body's not really going into that real deep rest and digest to start to knit that together. They're also going to check your digestion, because maybe you're not getting enough out of your food to kind of have the building blocks to knit that. And they're probably going to suggest some more specific herbs to go along with some of those dietary recommendations that will really help build the tendon and like flush out that inflammation and help you sleep and just feel better in general. I hope that helped. If you have any questions, please comment below and I'll do my best to answer them.